Hi friends, this is Dr. Abdequaem Chimthanawala. Today I will discuss a very simple case. A very simple case with some very important PQRS symptom and a very polycrest remedy that you might have used, that you are using in your day-to-day practice. There was a case in front of me, a case of severe pain in the abdomen, and the most important symptom was the pain in the abdomen was with always constipation. So the patient told that there is always pain in the abdomen when I suffer from constipation. Now, if you have this symptom, pain in the abdomen with constipation, you must remember 3-4 drugs. Of course, the first drug that you should remember is Bryonia. You remember the constipation of Bryonia? Stools dry, hard, large. Second, Plumbum metallicum. Third, graphitis. Fourth, Naxomica. Fifth, a very rare drug called Calimur. Calimur also has this same symptom, that pain in the abdomen with constipation. I repeat, pain in the abdomen with constipation. These type of patients you will get lots in your practice today in our day-to-day practice, because they are taking lot of other antibiotics, antihistaminics, vitamins, tonics, which normally causes constipation. So it becomes a very important symptom to prescribe, that is pain in the abdomen with constipation. The remedies are Bryonia, Plumbum metallicum, graphitis, Calimur, Naxomica. Because we always think first about Naxomica, but let us see how the patient told the symptom and how we differentiate these remedies and get to the simillimum. The second symptom was the pain always used to extend to the inguinal region. Now this is a very important pain. The pain in the abdomen extends to the inguinal region. The inguinal region. The second symptom which the patient told me. Now if you have these type of extension of pain, then the remedies above which I had discussed, differentiate these remedies. And the third symptom, the patient was very specific in answering that, डॉक्टर ऐसा लगता है कि ऐसी पेट में से कुछ ऊपर चढ़ रहा है, ऊपर गले तक आता है, ऐसा लगता है मेरे को पेट में से कुछ बॉल ऊपर तक आ रहा है, ऐसा लगता है. Now whenever the patient is telling you these type of sensations, you must remember or convert these symptoms into the language of mater medica, because this will easily help you to differentiate the remedies. What is the patient trying to tell you? That there is a ball sensation in the stomach which is rising up to the throat. So you must have guessed the remedy. So these 3-4 symptoms, and one symptom the patient told me कि कभी-कभी मेरे को इतनी कड़वी वॉमिटिंग होती है जब मेरे को सर दर्द होता है. वॉमिटिंग बहुत कड़वी जहर के समान रहती है. मतलब the vomiting is so bitter like a poison when I have headache. So if you convert this symptom again into the language of mater medica, what the patient is telling, that there is vomiting of bile with headache. So up till now we have heard 3 to 4 symptoms what the patient has told us. Of course, in the abdomen symptom you have to ask, how is the nausea? That will also help you to differentiate lot of remedies. When I asked the patient, आपको ऐसी nausea समान लगता है, उल्टी के समान लगता है, so he told, sir, nausea तो लगता है मेरे को, but उल्टी नहीं आती, vomiting नहीं आती मेरे को. Again, a very important symptom to prescribe, that is nausea without vomiting. Then your next symptom should be, आपको डकार कैसी आती, irritations कैसे है. See, whenever you can't decide what you have to ask, whatever the patient gives you, then you have to ask him the linking symptoms so that you can link the symptoms. First the pain, then the extension, then the ball sensation, then the vomiting, and now irritations. मैंने पूछा आपको irritations डकारें आती है क्या? And he was very precise in telling me that जब भी ऐसी डकार आती है ना, तो ऐसी बास आती है. डकार से बास आती, गंदी बास आती. So irritations were foul. This is how you must develop your case. You must ask the symptoms. And next symptom was bhook, appetite. Whenever the stomach is involved, you have to ask appetite. So I asked him, bhook कैसी है? Well, डॉक्टर साहब भूख ज़्यादा लगती है, सवेरे उठता हूँ, I get up in the morning, I don't like to eat, इनफैक्ट मैं दोपहर को खाना भी नहीं खाता हूँ, हाँ, लेकिन मुझे फिर शाम के बाद मुझे भूख लगती है. So I thought maybe because he's not eating the breakfast, he's not eating his lunch, so evening he is feeling hungry. That is quite normal. So I did not take that for prescription. I'll tell you further that how I reached the remedy. So now I had 3-4 symptoms of the remedy, that is pain in the abdomen with constipation. Second was pain extending into the inguinal region. Third, there is a ball sensation in the stomach rising up to the throat. Fourth, vomiting of bile with headache. And fifth symptom, that is nausea without vomiting and eructations foul. So these 5 to 6 symptoms normally would lead to one drug if you repertorize, and that is, you must have guessed it, that is Plumbum metallicum. This was an out and out case of Plumbum metallicum. That is, the symptoms of Plumbum metallicum are whatever I told you: pain in the abdomen with constipation, eructations, the vomiting, the bilious vomiting, and constipation. So I gave the patient Plumbum metallicum 200 single dose, called him after 15 days, and gradually all the symptoms, the patient always feeling better. Repeated that dose. After 2.5 months, all symptoms were totally cured. But now let's come back to the symptom what the patient told me about the appetite. If you read Plumbum metallicum, it is written in Plumbum metallicum that the patient has appetite ravenous, especially in the evening. See, sometimes we feel ठीक है, सवेरे दोपहर को खाना नहीं खा रहा है. If he's not eating in the morning or the lunch, he will have appetite or he'll be hungry after evening. But see what is written in Mater Medica: appetite ravenous, especially in the evening, and that is also Plumbum metallicum. One or two symptoms I would like to add about Plumbum metallicum abdominal symptom. That the first symptom is thirst after dinner. A Plumbum metallicum patient is thirsty after dinner. A very important symptom I have confirmed in many of patients. And the second symptom which I would like to bring to your notice, that is anus feels drawn up into the rectum. पेशेंट आके बोलता है, ऐसा लगता है कि मेरा लेटरिन की जगह रेक्टम पे मतलब ऊपर आके चिपक गई है. ये पेशेंट्स के वर्डिंग है. These are the wordings of the patient which I have heard, and then the language of Mater Medica is that the anus feels drawn up into the rectum. So these two symptoms you have to add in your. In fact, one more symptom which I recollect is eructations in Plumbum metallicum are sometimes sweetish like water. ऐसी लगता है इसको मीठा पानी आ रहा है गले के अंदर या मुंह के अंदर मीठा पानी आ रहा है. So apart from the case, these 2-3 symptoms are very important. First is eructations, sweetish water. Second, anus feel draws up into the rectum, and third, thirsty after dinner. And of course, the symptom of appetite, which is ravenous, especially after or in the evening. This makes a very nice drug picture of Plumbum metallicum stomach symptoms that you must remember. If you like this video, please do share and subscribe. Thank you.